As I have discussed elsewhere, the Institutional Animal Care and Use Committee, or ICOC, approves all work with animals, whether in the context of teaching, such as in this MORE class, or in the context of a research study. We submit annual reports to the ICOC to provide a progress report and to request an extension if necessary, or if the work has been completed, to close the protocol. These reports mandate the disclosure of any adverse effect to the animals as a result of the treatments they received. And they include strange responses by the animals or sickness and death. We are also required to report unexpected results or findings that are beyond what we would have been expecting during the normal progress of the study. For example, during a normal study where you do invasive surgeries of mice, you might expect one of the 10 animals to actually die following a surgery because of surgical complications. Now, for example, you start your project and 3 out of the first 8 animals die following the surgery. This is an instance where your study is stopped immediately. The Institutional Animal Care and Use Committee will review the procedures. You are asked to explain what you think went wrong and how you tend to address those issues to make sure that in future surgeries, no more animals will die. Now, if the ICOC is satisfied with your changes to the protocol and is confident that you've solved the problems of the increased number of deaths following the surgery, then the ICOC will approve a modified protocol and you can continue your study. However, if ICOC members are not convinced that your changes will do anything useful, they may actually terminate the entire study in its present form. Now, there are other things that the ICOC can do, additional restrictions on your protocol once the modified protocol is approved. For example, in the example of the surgeries, you may only be allowed to do 2 consecutive surgeries at a time to minimize the number of animals that might die if your new protocol actually doesn't show any improvement. Now, subsequently, you might be able to increase the number of surgeries you might be able to do at a given time. If, for example, the research shows that after 10 or 20 surgeries, you've had minimal side effects of the surgeries, the animals are recovering just fine, and you have shown that you can do the surgeries well.